You know by now, of course, if you've been following the story, that first it was 100, then 200, now somewhere closer to 300 doctors who have now applied for license to practice in other provinces, primarily Ontario, there's some in New Brunswick as well. And this, of course, follows the implementation of Bill 2. Now, you may also remember when this story first broke, basically a day later, Ontario Premier Doug Ford went public, asking doctors in Quebec who were considering leaving the province to call him directly. And he actually gave a number. He went on and said, hey, call me, 1-800-DOUG-FORD. Now, it turns out he wasn't kidding. His number is available online, and our next guest took him up on his offer and heard back. Dr. Caroline Lacroix is an assistant professor of diagnostic radiology at McGill, and she is on the line. Dr. Lacroix, thanks for your time this afternoon. Can I pick up on the story from there? You actually reached out to Doug Ford. What happened?
Yes, so that is true. I was curious, and so it was on a Thursday evening. I was alone home, and I decided to text him. I thought it was unusual and curious that the Premier of Ontario would make himself so available to Quebec doctors, or just anyone, actually, to try to contact him on his cell phone directly. And I was curious to know if that was true, given that in Quebec we have so much difficulties having our federation representative reaching out to our Premier and the Minister of Health, actually, here in Quebec.
So you go ahead, you say curiosity made you go ahead and follow through on the story for us. What happened next?
So a minute after I texted him, a simple question, just a general question about radiology and if there was any website where were listed the position opportunities and locums opportunities. He called me himself, and we chatted for a few minutes. And he was very polite, very welcoming, and basically explaining me how it worked in Ontario and some differences with Quebec. And he informed me that the Minister of Health will call me the following day, which he did.
Wow. I'm reacting this way. I'm wondering how you reacted. First of all, when he actually called you back, I mean, were you completely surprised?
I was very surprised. I did not expect it was true. So that was my main reaction. And then I listened to what he had to tell me. Right, and I appreciated his time, and I kept it very, very short.
And then you did get, as you just said, a call back from the Minister of Health. What was that conversation like?
So she was following up on the question I had sent to Doug Ford, and she did ensure that she had my email address and that she would follow up with any information in that regard. And asked me if I had any other question or any thing I wanted to bring to her forward regarding a possibility of coming to Ontario.
So now I'm assuming when you go ahead and do something like this, you obviously have, beyond curiosity, you have interest in saying, maybe based on Bill 2, I'm considering moving. So where are you on that particular part?
It's a good question. I'm on the fence. I think I'm still hoping that Bill 2 will not come into effect, that Legault will come to his senses and will take over the leadership and the discussion moving forward for the Minister of Health, and that the situation will resolve itself. That said, I'm a logical person, and if the situation continues to deteriorate, I will consider leaving the province at some point. But this is not my goal. This is not what I want, and I think this is not what any physician in Quebec right now wants. But we are kind of forced into it.
I would ask, by the way, with respect to any hurdles that you would have if you wanted to just, move your practice from here to there, what would that entail? Is it enough to make you think perhaps, no, this is not the way I want to go?
Very easy to move to Ontario, to be honest. Very, very easy. So the main reason I would like to stay in Quebec is because I'm committed to the practice in Quebec, to our patient, to my hospital, to my team. And I obviously have family here in Quebec.
So, there's an interesting survey out that shows, this actually came out just earlier in the week, that most Quebecers are not buying the government's explanation for why we need to have Bill 2. But yet at the same time, a lot of those same people who are polled seem to have the idea that doctors are paid too much, make too much money here in Quebec. What's your reaction to that?
Well, I think it's false information. Salaries across Canada are mostly higher in other provinces, at least for my specialty. So I don't think that the information spread by the ministry is accurate. I think it's incomplete information. And it gives the population in Quebec the false sense that Quebec doctors are too picky and asking for too much. But Bill 2 is not just about salary decrease, right? It's way, way more than that. It's an open violation to the Charter of Rights and Freedom of physician and healthcare workers. And then it puts in danger the healthcare system as a whole and patient safety. And this is the most sensitive court for physician. And this combination, the way it was brought forward, the way it was imposed, and the content it has, and the possible safety implication is what makes it really a very explosive mix, and why the reaction of Quebec doctors is so strong at the moment.
When you talk to your colleagues in the field that you practice in, what is there a general consensus? They will leave, they're considering leaving. What do you hear?
I'm not so much hearing about people wanting to leave as people being extremely concerned. So I'm a radiologist, and in radiology, Bill 2 will have very, very significant and very bad impacts as of January 1st, because our tariff or prices in the billing manual will be cut to a bit less than 87% of our current value. But that includes the incomes R7 and R9, which are billed under the name of radiologists that work in medical imaging clinic, but really are not a personal income. Rather, these are sums that are automatically redirected to the clinic management to cover employee salaries, rent, and any expenses related to storing and keeping the images of our studies. And these roles, R7 and R9, have not been increased in the past 10 years or so, and yet the increase in the expenses during that time is of at least 40%, largely due to inflation. So even before Bill 2, medical imaging clinics have been struggling to break even and not be forced to close. But with the additional income loss as of January 1st, radiology specialists are extremely worried that all medical imaging clinics will be put at risk of short-term closure. And even if you include the possible 15% performance bonus that could be given back to the clinics if the ministry targets are met, the delay in giving it back, which is about 4 months, is not sustainable for small businesses to have to pay their expenses as they come.
So just as a final question, you mentioned this is well beyond just remuneration, which some people think it is, but there's much more to this. Hypothetically, if the government does not withdraw Bill 2 and negotiations don't turn out to be fruitful, what do you do next?
I would be in a very, very tough position, I think, as many other specialists and family physicians, because at the end of the day, what doctors want is to give the best care of patient and practice in a safe environment, and Bill 2 is strongly against that. I think it's clear, the Canadian Medical Association, even the Collège des Médecins du Québec, are strongly against Bill 2, and at some point, I think Mr. Legault has to come to his senses and remove that.
We leave it at that. Doctor, I thank you so much for your time. Very much appreciate it.
Thank you. Bye-bye.
Seasoned gamer or just video game curious? This Week in Gaming is the podcast for you. We break down the latest in the world of video games, from basics to beyond. The hottest gaming news, insight, and industry leaders and more, weekly. Join me, Naomi Kyle, and stay ahead of the game with all the latest updates, even if you're a total newbie. Stream This Week in Gaming on the free iHeartRadio app or wherever you get your podcasts.